Let's focus on cost savings to your practices. eConsults delivers savings by replacing referrals, reducing unnecessary testing, limiting emergency visits, avoiding hospital readmissions, and offering medication management. An e-consult that avoids specialty referral results in 3 avoided specialty visits, which is the average number of appointments needed to diagnose and treat a patient. Each specialty visit costs approximately $300. The avoided visit savings to an at-risk practice is $900. Approximately 20% of patients have non-clinically indicated duplicate testing, which can be avoided by using e-consults. Average per patient, unnecessary tests and lab work costs around $85. Accounting for the cost of the e-consult, the total cost savings would be $885. This example reflects the cost savings for a typical patient. What if your patient is at risk of visiting the ED, was recently discharged from the hospital, or takes multiple prescriptions? There are more than 139 million emergency room visits each year. The Agency for Healthcare Research and Quality estimates that between 13 to 27% of these visits could be managed outside the ED. Using a conservative 13%, 18 million ED visits could be avoided annually. Across the average patient panel, 137 ED visits could be managed in the primary care setting, a savings of $157,000. This is the single biggest area of potential cost savings from our primary care practice, followed by hospital readmissions. A single hospital readmission costs around $15,000. 14% of patients are readmitted to the hospital within 30 days, and 27% of these readmissions are avoidable. This translates to about 7 patient readmissions within the average PCP patient panel. That's $105,000 annually. If you have a higher percentage of elderly patients or manage high number of chronic conditions or comorbidities, this number could be much higher. More than 56% of patients will experience a drug-related error. Errors related to diagnosis were the most common reason. Not all errors will result in an adverse drug event, but surprising a number will occur each year. The result is more than 1.3 million emergency visits and 350,000 hospitalizations. The cost of an ADE averages $9,900. Patients recently discharged from the ED or inpatient care are more likely to experience an ADE. Only 10% of elderly patients will be discharged on the same medication that they were admitted on. 60% of patients will have 3 or more medicines changed during their hospital stay, while 28 to 40% of the medications are stopped while they're in the hospital. And 45% of medicines prescribed at discharge are new. Consulting a PharmD for a medication review via eConsult following a hospital discharge could save your practice a tremendous amount of money. The typical patient panel will experience 4 ADEs each year, costing your practice $9,900. The total potential savings per provider panel is a whopping $342,000. Multiply $342,000 times the number of providers in your practice, and it becomes obvious that leveraging eConsults will benefit your practice and your patients.